Cooper, board-certified GI doctor, and we're talking about when and why you would have a colonoscopy. Now, I think of this in 4 basic categories. There's screening colonoscopies and surveillance colonoscopies, and these generally surround colon cancer prevention. There's also diagnostic colonoscopies and therapeutic colonoscopies, and we're going to talk about each of those categories in this video. To start a screening colonoscopy, when should you start screening? Recently, the U.S. Preventive Task Force followed the recommendations of a major paper that was published within GI journals, stating that we should be considering adjusting the screening age from 50 to 45. That was a few years back, and it's become now broadly accepted. And because the U.S. Preventive Task Force agreed with this, it also is covered by insurance starting at 45. So from age 45 to 75, we talk about screening colonoscopies. Now, certain people are higher risk for having colorectal cancer. This might be people who have known genetic defects that put them at higher risk for cancer conditions, or if you've had family members that had colon cancer, especially young in life. This is a case by case, and it gets rather intricate, whether you need to have more accelerated colonoscopies, be that earlier or more frequent. But the big idea here is stay 10 years ahead of the youngest person who ever got colon cancer in your family, and think about doing them at least every 5 years, even if you've had no problems. Now, a surveillance colonoscopy follows when you've had a screening colonoscopy that found polyps. Polyps have different types, and some of them are completely benign, but some of them have the potential to become cancer. We usually think of that as a process that follows a number of genetic mutations leading towards cancer. So polyps themselves are not cancer, but over time they have the risk to be. And we know that if we remove polyps, then we have the opportunity to prevent cancer. And we know that polyps can recur like weeds in a garden. And so basically you have to go weeding every few years if you've had a history of polyps. And that's a surveillance colonoscopy. And we follow guidelines that tell us, based on how many polyps you had in the past, what type they were, what size they were, how frequently we need to go and weed your colon. Diagnostic colonoscopy should be considered when you've had a change in symptoms that suggest something might be amiss in your colon. So if you have a change in bowel habits, if you're having chronic diarrhea, or if you're having pain with bowel movements, certainly if you're having bleeding, because in these cases we need to rule out concerning conditions. Also, if you have a known condition like an inflammatory bowel disease, then from time to time we need to check on the health of your colon, and that would be a diagnostic colonoscopy. A therapeutic colonoscopy occurs when somebody comes into the emergency room bleeding, and we need to quickly get that bleeding to stop. That sometimes involves what's called a purge prep. It's a very rapid prep, and we take less than perfect results with the goal of quickly getting in and trying to seek out the cause of bleeding. Other times we'll have someone who has a painful condition because they have a stricture in their colon. This is a tightened area that we need to open up through a process called dilation. That's another type of therapeutic procedure that I'll perform. In closing, this is journal advice and not meant to be specific for any patient, so if you have questions, please ask your provider. Hope you enjoyed this information. If you did, like the video. Also, please subscribe and look for other content where we cover other procedures we perform within GI and some of the specific conditions that might have a person receive a colonoscopy. Thank you for your time, and be safe.